Hi, this is Ciesielski. I'm going to do an exam on the cranial nerves. First, I'd enter the room, wash my hands, provide privacy for the patient, explain to the patient, I'm Ciesielski, I'm a registered nurse. I'm going to be doing a cranial nerve assessment and answer any questions. The first thing I would test for is olfactory, which we're not testing today, but that would be coffee grounds or vanilla beans. So I'd say olfactory cranial nerve number 1 is intact. Number 2 is optic. Optic is the visual acuity and the Snellen chart. Visual acuity would be would be patient covering one eye, same eye that I'm covering, yeah, on the same side. And we'd be at the same level. I'm going to be checking his peripheral vision, so I'm going to be checking different quadrants. All right, tell me how my fingers?
2.
Okay. So looking straight at my eye. Okay.
3.
Okay. Cover the other eye. Looking straight at my eye.
1.
Okay.
3. 4.
Okay. Checking. Peripheral, checking the patient's peripheral. I did get a couple wrong, but the next thing would be the Snellen chart. I would ask the patient, do you wear glasses or any type of eyewear, such as contact lenses? Place them 20 feet away from the Snellen chart and ask them to read the lowest line that they can, without getting 3 or more wrong. 3 or more wrong means they failed. I would have them cover, since we don't have the Snellen chart here, I would have them cover one eye. I would do that exam. Again, 3 or more wrong, I would have them read the one above it, and hopefully they would get that one right. If not, we would keep going above until they can get less than 3 wrong. And then I'd have them cover the other eye, same thing. And then I'd have them do the exam with both eyes open. Assuming all that is correct, I would say optic nerve number 2 is correct, or is intact. And then I would go to number 3, which is ocular motor, checking ocular vision. I do the starburst pattern on the patient. So I would have the patient looking straight at me, and I'm going to just follow with your eyes. Do not move your head. Approximately 2 feet away from the patient. Good. And then I would check for pupillary dilation. Can you check here? Good. Pupils are round, reactive, restrictive. They're accommodating. I can also check this eye. I'm going to do that to make sure that this eye is reacting to the light on this side. It is. So cranial nerve number 3, ocular motor, is intact. Number 4 would be trochocular. And trochocular would be looking directly at me, or look at this pen light, and I can put it down, but you can just follow it. Keep your head straight. It's the up and down, and then it's the in on that. Again, like it's 8 centimeters or up to 2 feet away, they can do this exam. I'm watching to make sure that the patient's eyes go in when I go inward toward the patient. So trochocular number 4 is intact. Number 5 is trigeminal. Trigeminal is the muscles and also face sensation. We don't have to test face sensation on this exam, but trigeminal, it's muscle strength. So I put my hand here, go ahead and push against it. Okay, here, okay, forward, push up, okay, push down, good, back, good. All right, I would say the trigeminal nerve number 5 is intact. Number 6 is abducens, which is the left to right movement. So look, we've already tested this when we did the starburst pattern, but here, left and right. So I would say ocular nerve number 6 is intact. Number 7 is facial, and facial is muscles of mastication. So you can go like this. I want to feel these muscles. That feels good. He's all balled up. Go ahead and scrunch your eyes closed like this. Good. And open, really open. Eyebrows up. Puff your cheeks out. Good. Smile. Frown. Okay. Let's say mama.
Mama.
Baseball player.
Baseball player.
Speech is good. Facial is also tears and taste, both of which we don't have to test for today. So facial nerve number 7 is intact. The next is acoustic. Number 8 is acoustic. So I'm going to cover this ear and I'm going to whisper baseball. What did they say?
Baseball player or baseball?
Okay, over here I'm going to do the same thing. Orange and carrots.
Orange and carrots.
Okay. And the second part to acoustics is equilibrium, which I can have a patient walk a straight line. Good. Okay, go and sit back down. So I would say that the patient has passed the acoustics. Number 8 is intact. Number 9 is glossopharyngeal, and that is when I would use a tongue depressor, and I would say say ah. Okay, open your mouth, act like this is a tongue depressor. Good. And then I would also say, so the patient does pass that, and then I could elicit a gag reflex. I could go way back there and have them gag. So cranial nerve number 8 is 8 is intact. 9 is intact, glossopharyngeal. Number 10 would be vagus, and vagus is hoarseness and swallow. So I've been talking to the patient, and they have had no problems, but I will say, give me your name, please, and your birthday.
John Ciesielski.
And your birthday?
January 25th, 2012.
Okay. And do you know where you're at right now?
9254.
Okay.
Palmer Fest,
Nine.
Michigan.
Now, no hoarseness. And then I can put my hand down here. Just give me a swallow. Good. Swallow is intact. So vagus nerve number 10 is intact. 11 would be spinal accessory. And with that, have the patient move their head side to side. Good. Up and down. Good. Push against my shoulders or my hands. Push up. Good. No, use shoulder shrug up. Shoulder shrug up. Good. All right, that is good. And then I already had him check a lot of the other muscles with pushing against my hand with the trigeminal. So spinal accessory number 11 is intact. And then the last one is hypoglossal. And hypoglossal is to stick out your tongue. Good. No, stick it like that. And then go, and then go from side, straight out to start with, and then go side to side. Good. Hypoglossal, that's nerve, that's cranial nerve number 12, and that is intact. That's the end of the exam.